Taba well ubona wena. Okay, so pass it. Ngifuna iplug. Sinokupluga i-charger emisini. Kunayo kufanele ahlale. Akanayo ino-Bluetooth lena.
Oh, yeah. Oh, perfect. I'll try it. I'll find it. Hey, not this. I'm proud of you. Where's that? Hey. I'm just about to get it. But wait. When we are ready, we are going to start.
Hey, hey, they like that. Yang cinca di dentro ya, man.
Yeah, I think it makes sense that way.
1, 2, 1, 2, 1, 2.
Yeah, we're starting.
Sanibona. Aphathi sanibonani.
Colleagues, greetings. I think we are ready to start with our media briefing today. We have been joined by the Honorable Premier of the Province, Premier Sihle Zikalala, together with the Honorable MEC for Health, MEC Smelani. Welcome all the colleagues from members of the media, government. We also welcome the colleagues that are watching us on the online platforms. The Premier is going to take us through the latest developments with regards to our COVID-19 situation in the province.
Thank you, Mr. Mabaso. Greetings to all. MEC for Health in the province of KwaZulu-Natal, Honorable Nomagugu Smelane, government officials led by Mr. Mabaso, members of the media, distinguished guests and compatriots, thank you very much for attending this media briefing, whose aim is to bring the people of KwaZulu-Natal and the nation up to speed with developments pertaining to COVID-19. This deadly pandemic remains one of the toughest challenges of our time, which makes the regular sharing of information a critical part of winning the battle we are facing. We therefore appreciate the role that the media is playing in this regard. We wish to start by highlighting the fact that upon our assessment of COVID-19 situation in the province, our provincial cabinet has resolved to approve the extension of contracts for employees or staff appointed as part of our COVID-19 response plan. This extension is for a further 6 months, which is from the 1st of September 2021 to the 31st of March 2022. This means that more than 15,000 staff members, including nurses, administrative clerks, data capturers, and general workers, among others, will be retained to lead the provincial effort to defeat COVID-19 so that we ultimately achieve population immunity. We highly appreciate the contributions made by these recruits since COVID-19 started, and we want to call upon them to continue working with diligence and dedication in the service of our fellow compatriots. In the same breath, we express our full gratitude to all healthcare workers who have continued to soldier on under difficult situations since the pandemic began. We also fondly remember and pay tribute to all those who have passed on due to the virus. when one look on the vaccination, our vaccination effort is now in a high gear. This week, the province reached above 2 million mark in terms of the number of inoculated persons. We have, as the province, a target of vaccinating a total of 7.5 million people if we are to contribute meaningfully to the country achieving population immunity for the COVID-19 virus. Our target is to reach 60,000 daily vaccination, which could help us reach our target by the end of March next year. This will allow us to firmly focus on the task of rebuilding the economy and saving jobs. We are very encouraged by the positive response that have been seen and shown by young people aged from 18 onward who have come forward to get vaccinated since they became eligible for this a few days ago. We share this sentiment that have been expressed by academics elsewhere that the vaccination of the over 18 cohort is good for us in a number of ways. Firstly, it means that all adults with comorbidities are now eligible for vaccination. Secondly, as a relative young country, the over 18 population group is quite sizable and influential. It is therefore, it has power to change the narrative around vaccination and make it positive. This is especially so because of their access to social media, which is one of the places that shape people's opinions and their general outlook. So indeed, we are pleased that the over 18s are now coming out in their numbers and sharing their selfies and posting videos of themselves getting vaccinated. May this spirit continue because it has a number of these positive spin-offs. This also means that these youngsters will be safe from the virus, but also they will pose less of a threat to their parents and grandparents and other members of their household who might be of advantage age or be living with comorbidities. We have so far registered 216,754 aged between 18 and 34 and have vaccinated 55,302 of them from the 20th to the 27th of August. This gives us an average of 7,000 vaccination amongst this group per day. When we do a comparison between the waves that we have had, we realize that the highest number that we recorded in a day during the second wave was 6,700, while during the third wave, the highest number has so far been 4,198. We remain concerned that our numbers are on the upward trend, while the difference this time around is that children, mostly learners, are also getting infected. The overall percentage change in the number of new cases between week 33 and week 34 was 33%. The actual number of new cases recorded was 15,333 for week 33 and 22,817 for week 34 respectively. This increase in the number of new cases was noted across the province. Within the last 24 hours, which is our reporting cycle, we have had 3,107 new infections, bringing the total number of confirmed cases to 474,026. We currently have 59,274 active cases and have sadly lost 13,433 people, and we pray that their soul must rest in peace. There have been 400,000 and 455 recoveries. The number of daily hospital admission has also increased in both private and public hospitals. Over the past week, 2,648 people were admitted in public and private hospitals. The upsurge in cases has moved from Mutukela, Amajuba, and Umzinyathi. Currently, the districts that are recording a high number of cases daily are eThekwini, Umgungundlovu, King Cetshwayo, Zululand, Umkhanyakude, and Ilembe. These districts have for the past 3 weeks had continuous high number, with eThekwini accounting for more than 40% of cases a day. Now, the province has had more than 1,100 COVID-19 cases in 350 schools in the past 3 weeks. These numbers are increasing daily, and more learners are testing positive. Sadly, the pandemic has claimed the lives of two 12-year-old children as well as a 9-year-old. And we're emphasizing this point to indicate the age of the people who are now who are getting infected, and sadly, some are passing on. The Department of Education is intensifying non-pharmaceutical interventions to reduce the spread of the virus in schools. Clusters have also been observed in other congregant settings, such as boarding schools, mental health facilities, centers for visual impaired, and old age homes. We urge those who are requiring assistance where there are clusters to contact the National Institute for Communicable Disease on their toll-free number, which is 0800 029 999. In terms of intensifying vaccination effort, we would want to emphasize that in order to defeat COVID-19, vaccination is the obvious key and most important intervention to save lives. Of course, this must be done in conjunction with non-pharmaceutical prevention measures such as wearing of masks, regular hand washing or hand sanitization, as well as social distancing. We've begun taking a closer look at whether the people who get vaccinated at our facilities, on whether people who get admitted at our facilities were indeed vaccinated, so that we can establish scientifically how many of them recover and how many eventually lost their life. Looking at admissions between the period of the 16th of February to the 14th of August, we have had 13,119 hospital admissions. And in terms of these admissions, it concerns us that of the total admissions for this period, only 3% or 384 were vaccinated, while 57 or 7,523 had unknown vaccination status, and 40% had not been vaccinated, and that 40% is 5,212. While more data is being collected and more detailed analysis is still being conducted, which will provide scientific and medical explanation to this, at face value, it does appear that the majority of people in hospital and those who sadly passed away were not vaccinated. We have also observed that the majority of vaccinated people face mild symptoms and were quickly discharged from hospitals. It does appear from these preliminary observations that if you are vaccinated, you stand a better chance of fighting successfully against COVID-19. On the issue of deaths at home, as the province were concerned by the 227 confirmed cases of COVID-19 people who have died at home, though this number could be much higher. This is because of the high number of people who are dying at home, but their mortal remains do not get tested before they are buried. We are therefore once again urging families to allow or request funeral parlors to test these human remains for COVID. This is a service that the Department of Health offers for free. It is extremely important that we properly document these deaths because that informs our approach and strategies to save lives in future. In terms of speculations about the festive, the third wave seems to be taking long to subdue than the other two waves. We continue to closely monitor trends associated with it. At this point, it is difficult to say what kind of December holiday seasons we will have insofar as infections and fatalities are concerned. Only time will tell in this regard. But for our part, we are implementing our plans, which is only as good as the public are willing to play their part by getting vaccinated and also observing all non-pharmaceutical prevention measures, which we are urging them to do. With regard to Heritage Month, as we enter Heritage Month in September, this period assumes greater significance in our province in the light of the recent civil unrest, which led to death and disruption of business. This period presents us with an opportunity to introspect and reflect about the lives that we lead, and about our past as well as about the future that we want to create and leave behind for our children and future generations. It is also an opportunity for us to heal from the deep scars of our painful past and it associate injustice and hate, and to tolerate and accept each other in order to forge a future of unity and togetherness. As government, we will use Heritage Month to contribute to the rebuilding of the province's moral core and to help grow a society that is united in its diversity. We have resolved to host a hashtag We Are One festival, which will be held in compliance with all COVID-19 protocols. This occasion, whose details will be communicated in due course, will be utilized to unite and promote social cohesion across the different cultures. Government hereby invites the people of the province of KwaZulu-Natal to also use Heritage Month to engage in dialogues and programs to focus on youth and women empowerment, teenage pregnancy and HIV, drugs and substance abuse, and the whole issue of the gender-based violence. As we conclude, We wish to indicate that this week we will intensify our vaccination program with partnerships between government, business, faith-based organizations, traditional leaders, media, creative industry, and institutions of higher learning. We will from this week launch a series of vaccine pop-up sites and ward-based vaccination drives. We are concerned about the two emerging strands between vaccinated and unvaccinated people. We note that the vaccinated people now want to have more access to sport, entertainment, and hospitality. We are also mindful that we still need to get everyone vaccinated. We would want to clarify to those who are still vaccine hesitant that vaccination is the first step to getting our lives back to normal. Vaccines are safe, and this has been confirmed by all regulatory and scientific bodies. Those who get vaccinated may suffer mild symptoms, which may include headache, fever, fatigue, muscle pain, or a runny stomach, which simply implies that the body is building resistance against COVID-19. These can be managed through rest and medication prescribed by doctors. In instances where any side effects are not subsiding, we recommend that patients present themselves at their nearest healthcare facility without waiting for too long until complications set in. Let us all vaccinate and be remembered as the generation that helped create a COVID-19-free KwaZulu-Natal and South Africa. With that, we wish to thank you all, and we call on all of us to be the ambassadors for this vaccination drive. Thank you.
Thank you very much. Now we move straight to questions. Currently, the question I will start in this house by show of hands. Do I see any hands? The lady on the side, followed by my usual suspect, first corner. Is there any other hands? Okay, go ahead in that order.
is there a program of action that the provincial government is already thinking ahead, given the province's history with violence when it comes to politics, or is everything just left resting on the court's decision on the local government elections?
Okay. Not sure that was COVID. Definitely, you call it.
Yes, someone Talisoko from the Witness newspaper. I just want, the last time we were here a couple of weeks ago, schools were a big issue. And I think we just said that 3 learners have died so far. I think we have seen some sort of protest from parents, some parents holding, stayaways, not sending their children to school. So I just want to know, have you been talking sort of to maybe parents or people, organizations, representing parents, and just what is just what is the situation, just in terms of parents who are sort of scared about taking their children to school?
Or are you asking what would be the message of Premier Embassy on the parents who are scared to take their children to school?
Yeah, and just if they've spoken to organizations representing parents.
All right. Anything online, colleagues, so far? We'll hand over to you. Welcome.
Thank you. No, thank you very much. Good afternoon, ladies and gentlemen. Colin, I'll start with your last question. I will not comment on the approach of the opposition parties, particularly because the DA, represented by Zwagele Mngcango, have indicated that they want to take the matter to court. So it is now going to be a matter that is subject to care. And I then reserve a right to comment and present my side of the story in court. The first question you asked is, will we be visiting the private vaccination sites? We have a huge program, actually. We have a huge program at the Department of Health that talks about a number of programs that are aimed to encourage people to come and vaccinate. And some of those programs are your drive-through programs that we have. We started in King Kechwai. We are now implementing it in eThekwini, and we'll be moving to Umgungundlovu and in all the urban sites, because we believe that is a very innovative program, and people actually are quite excited to get that. We also have a program where we are vaccinating people in taxi ranks, because you also don't want to be seen as the department or as government to be preferring one sector over the other. So we've decided that we must be able to actually take care of everyone. So indeed, we are going to those sites, and we started in eThekwini and we'll be moving out throughout the province. And a majority of those sites, we are actually managing together with the private partners. It's not just the Department of Health that are managing those. I'm giving you these programs because I want to indicate that, yes, there are sites that we are managing on our own, but there are also sites that are managed together with the private partners that will include either your NGOs or companies. In fact, we are running a program with SPA, in partnership with SPA, where they decided that they want to vaccinate all their health workers, and we came into a memorandum of agreement. And one of the conditions, or our request, Premier, maybe not a condition, our request was that while we support them in vaccinating their own workers, can they also expand to the nearest workers in the place where they are at? And they agreed, and it's a very nice partnership. So we do have a lot of partnership or programs that we are running with private sectors. Where you might not necessarily be able to see us is where there are chain superstores or chain organizations that are running those. Not necessarily because we are not supporting them, but it's because we often are aware that they are running them quite smoothly. The Department of Health, led by the head of department and Mrs. Msimang, who's the DDG responsible for vaccination, any private vaccination site before it's instituted, they engage with whichever partner or whichever private owner is establishing that, and everything else is dealt with within the Department of Health. But yes, where you have mass vaccination sites that are managed by your private sector, we certainly are going to be part of those, and we'll be visiting. I'm explaining this because I want you to understand that any vaccination site, right from the beginning, government is involved. It's just that it depends on the nature of it, how big is it, and then you might not necessarily see us visiting there because the admin has been done up front. The last question from Mutabiso was whether the Department of Health and Education have engaged the parents in terms of the worry. I think we must also indicate our worry as government, and I think the Premier emphasized that when he started, to say we began seeing clusters earlier on in the month, and we are seeing them increasing, and that for us is a serious worry. But as the Department of Health, despite the fact that initially the scientists gave an indication that COVID-19 does not affect young people as adversely as other, as the older generation, but what we are seeing in other areas is actually the opposite of that, hence the fatalities that have been reported. So we've also requested our scientists to go back and actually do a proper research and come back and inform us on what actually is happening, what could be the cause. You might find that some of these young people, when they pass on, they might have, or when they contracted COVID-19, they might have had comorbidities. But that is something we can't just assume. We actually have to do a proper research and be able to explain and get a report. So we are working on that. We have requested our scientists to do that. In the meantime, the Department of Education and ourselves are working on a strategy to try and talk to the different stakeholders. If you remember when COVID-19 started, one of the big stakeholders that we engaged on were stakeholders from the Department of Education, because there were quite a few children that were involved. So we met with educators, we met with principals, we also met with the parent unions, and it's something that we are looking on how we're going to implement it moving forward, because you are correct. We do need to engage with them. We do need to allay their fears and address some of the issues or where they have concerns. But you also don't want to give parents information that is incorrect or information that is half-baked. So we are working towards that. I think I've responded, Mr. Babaso, to the questions that have been asked.
Yes, thank you.
No, thanks, MEC Smilani. Whether we will be visiting private facilities, we are encouraging the vaccination in all areas, public and private. And therefore, in some cases, you will, of course, see us taking the campaign even to private areas, encouraging that people use all areas that are, all facilities that are available for vaccination. On the issue of local government, indeed, local government, if the court finally says, let's proceed with local government, we do have plans to ensure that we deal with any threat to peace and stability. That includes the Provincial Multi-Party Committee, which is comprised of all parties. It always tries to proactively identify areas with potential threat and intervene, trying to mitigate and ensure that all threats are addressed in advance. So that is part of what as government we're doing. But also law enforcement agencies will obviously have plans to deal with challenges when we go to elections, if elections continues. Having said that, I think the sentiment by opposition should be taken as a sentiment from opposition. In most cases, in our situation, there is no sincerity from the opposition. It is just politics. It is just a game of trying to take advantage. It is just opportunistic tendencies that seek to undermine the government rather than to oppose objectively and based on facts. And that's why we would want to take that issue as it is. And we will stand at that level because we will not want to glorify desperation, because some of the activities of the opposition just come from that state of desperation. Sesikushilo lokho, ukusummarize kafishane ngeSizulu, namuhla sifisa ukuqala sibonge again ngesupport yabezindaba nabo bonke abasilekelelayo ekwazini ukuqhubeka sifundise sichazele abantu bakithi ngesimo esibhekene naso se-COVID-19. Kuliqiniso ukuthi ulwazi lubaluleke kakhulu ukuze sikwazi ukunqoba lesi sifo esibhekene naso. Okokuqala siyafisa ukusho ukuthi njengohulumeni sithe uma sibheka isimo se-COVID-19 nokubheka ukuthi le third wave esibhekene nayo ayipheli, sabe sesithatha isinqumo esithi masimukele isicelo sika-MEC for health sokuthi ama-contract abantu abaqashwe ukubheka ukubhekana nalesimo se-COVID-19 sikwazi ukuwaqhubezela siwa-extend. Laba abantu more than 15,000, iningi labo abahlengikazi, ama-clerk aseyibhedlela, abantu abaqoqa be-capturishe ulwazi nemininingwano about abantu abavaccinatayo noma abantu abaphethwe yisifo se-COVID-19. Lokhu kusho ukuthi laba bazoqhubeka basebenze until uMarch ka-2022. Ngiyafisa ukuthi sigcizelele ukubabonga ngemisebenzi abasenzela yona, but masibonge kakhulu futhi abahlengikazi, odokotela nabo bonke abasebenzi bezempilo abaqhubeka njalo nokuthi bagalele baqinisekise ukuthi lempi yokunqoba i-COVID-19 iyaphambili. Sizwakalise amazwi ethu okuzwelana nalabo abadlulile besebenza njengabahlengikazi nodokotela ukulwa nalesi sifo nabanye. Kuleli sonto siyafisa ukusho ukuthi KwaZulu-Natal idlule u2 million ngabantu abakwaze ukuthi bagome. Noma kunjalo, itarget yethu ukuthi sigoma abantu abangu 7.5 million at least ngoMarch kanyaka ozayo. Lokhu kusho ukuthi ngosuku asigoma abantu abawu-60,000 okuyisibalo-ke singakafiki kuso. So into esibhekene nayo kakhulu ukuthi in addition ngaphezu kokuthi sikhuthaze ukuthi abantu basebenzise ama-mask, ba-social distance nokunye, ngaphe kwalokho kumele sikhuthaze kakhulu abantu ukuthi bakwazi ukuthi bathathe umgomo. Ngiyafuna futhi ukubonga ukuthi intsha le eneminyaka engaphezu ka-18 ibonakala ikhuthele ngokuthi iye kogoma, ikwazi ukuthi igome. Sikusho lokhu ngoba le ntsha eneminyaka engaphezu ka-18 okokuqala iningi ezweni, but okwesibili ine-influence enkulu emphakathini ngoba iningi labo lithola lisebenzisa iy'nkundla zokuxhumana kalula, but futhi liyakwazi ukumuva ngokushesha. So siyafisa ukubonga njengoba sibona abantu abasha begoma, bathatha ama-selfie, abanye bathatha ama-video, bawaposte okukhuthaza ukuthi abanye abantu bagome. Kulesikhathi nje esifishane esikuso sesibhalise abantu abangu-216,754 abaseminyakeni esukela ku-80 kuya ku-34, kanti asebegomile bathatha imigomo bangu 55,302. Lokhu nje kwenzeke within izinsuku eziyisikhombisa from umhla ka-20 kuya kumhla ka-27. Siyafuna ukugcizelela ukuthi masiqinisekise ukuthi sonke silithathela phezulu uhlelo lokugoma. Uma sibheka i-third wave ne-second wave uma siqhathanisa, kwi-second wave iy'namba zayinyuka kakhulu, khona isikhathi la esake sathola khona ngosuku abantu abangu-6,700 ababetheleleke ngosuku olulodwa. Kulokhu kwi-third wave ibalo ezinkulu zigcina ku-4,196. Kodwa into esibukeka siyibona ukuthi i-third wave iya ngokubande okusho ukuthi ithatha isikhathi eside. Kodwa i-second wave noma ingathathanga isikhathi eside kakhulu, kodwa yayiya phezulu kakhulu ngosuku ngey'namba. Uma sibheka abantu ukutheleleka kulesikhathi esikuso, iyaqhubeka nokunyuka i-infection rate, ngoba uma ubheka kwisonto lika-33 abantu abawu-15,333 abareport ukuthi bathelelekile, kanti kwisonto lika-34 okuyileli sonto eliphela izolo abantu abathelelekile babe u-22,817. Lokhu kusikhombisa ukuthi izibalo ziyanyuka kakhulu. Siyafisa ukugcizelela ama-district afana neTheku, Mgungundlovu, Ikhingcetshwayo, iZululand, uMkhanyakude neLembe babonakala bekhula kakhulu, izibalo zabantu ziyakhula abathelelekayo. And kuma-cases onke amasha usuku nosuku, iTheku li-accounta for at least u-40%. Enye yezinto esiphethe kabi ukutheleleka kwabantwana ezikoleni. Singasho nje ukuthi KwaZulu-Natal sekurekhodwe abangu-1,100 abantwana abathelelekile ezikoleni ezingu-350 kulamasonto amathathu edlule. Ngeshwa abantwana ababili abaneminyaka engu-12 badlulile emhlabeni, owesithathu kanti ube neminyaka engu-9. Umnyango wezemfundo uyaqhubeka nokuqinisa ukuthi kulandelwe yonke imigomo ebekiwe ukuvikela isifo se-COVID-19. Siyafuna ukugcizelela ukuthi kumele sonke sikhuthalele ukugoma ukuze sikwazi ukuricha ibanga la esizokwazi ukuvula khona umnotho nokuvula khona izinto ukuthi zibuyele esimeni ngendlela. Siyabona abantu esebegomile bayafisa engathi kungavulwa yonke into, i-tourism, ezemidlalo bakwazi ukuya ey'nkundleni zemidlalo babukela amathimu abo. Kodwa ngenxa yokuthi khona abangakagomi, kulukhuni ukuthi sikwenze lokho ngokushesha. Yingakho-ke sinxusa ukuthi masiqinisekise ukuthi umgomo siwuthatha sonke ngokushesha. Uhlelo lokugoma silithathela phezulu. Njengesifundazwe siphatheka kabi ukuthi abantu abangu-227 abatholakala ukuthi bashonela emakhaya babe benesifo se-COVID-19. Kodwa futhi iqiniso lithi thina sikhuluma ngalo 227, kodwa baningi abanye okungenzeka ukuthi bashone bangabikwa ngoba akuzange bathestwe kumbe bathi mabedlula kusheshe kube ukuthi bayabekwa. And siyafisa ukugcizelela ukuthi abantu mabakwazi ukuthi bacheckwe, and nabantu uma kushona abantu emakhaya uma bebahambisa ey'ndaweni la sigcina khona abantu esebedlulile ema-mortuary, masicela ukuthi bathestwe ukuze sikwazi ukwazi, ngoba lolo lwazi liyasilekelela endleleni esilwa ngayo nalesi sifo. Njengoba sesibheka emaholidini nje kaDisemba, angeke saqinisekisa ukuthi isimo sizoba njani njengamanje Kodwa kubukeka kuhliya ukuthi sonke kuyadingeka ukuthi sigqugquzele ukuthi sigome ukuze impilo yabantu neyethu siyisizwe ibuyele ekutheni ibe normal, sikwazi ukwenza izinto ngendlela ebesijwayele ngayo. Kule nyanga esongena kuyo, inyanga kaSeptember, njengohulumeni wakwaZulu-Natal, sibheka isimo esivela kuso seyibhelu, sithathe sathi inyanga kaSeptember kuzoba inyanga esigxilisa ubunye kuyo nokubuyisana kwabantu bakithi. Sithathe-ke sathi sizoba nefestival ebizwa ngokuthi #WeAreOne. Siyisizwe esisodwa, we are one nation. Sizoyibamba silandela imigomo yonke ebekiwe ye-COVID-19. Sigcizelela ukuthi masibheke ukwakha kabusha ukuthina njengesizwe. Kule nyanga yamagugu masibheke ukuthi imvelaphi yethu ithini, sibuyisana kanjani, sihlalisana kanjani siyizinhlanga ezihlukahlukene nezizwe ezihlukahlukene. Kodwa siqinisa futhi umphakathi ukuthi ixoxisane ibe naney'nhlelo ey'bheke ekutheni sakhe isizwe, ekuthuthukisweni kwentsha nomama, sinqande ukukhulelwa kwabantwana besebancane, sinqande ukubhebhetheka kwesifo se-HIV and AIDS nokusetshenziswa kwey'dakamizwa, ngokunjalo sinqande ukubhebhetheka nalesi sihlava sodlame olubhekiswe kubantu besifazane, gender-based violence. Uma siphetha, masigcizelele ukuthi siyisonke, uhulumeni, zinhlangano zosomabhizinisi ney'nhlangano zenkolo, abaholi bomdabu, abe indaba, nabo bonke siyafisa ukuthi umyalezo wethu ube munye, ukukhuthaza abantu bakithi ukuthi bakwazi ukuyovaccinate, bagome, sizivikele kulesi sifo. Siyabonga.
Thank you very much, Premier MEC. I think colleagues will adjourn at this point until the next engagement. Thank you very much.
Futhi unesandla sesizulu.